Welcome to your 2021 employee benefits. Here are the list of items that we're going to review. So the medical options with Blue Cross Blue Shield, Delta Dental, Vision, and your voluntary options. Your open enrollment period starts today and will terminate on November 30th. All employees who have met their pre-eligibility criteria are eligible for benefits, aside from yourself, legal spouse, a domestic partner, or children up to the age of 26. The benefits that you're going to review and enroll in are effective January 1, and you cannot make any changes unless you experience a qualified event. Some of those events are marriage, divorce, birth of a child, loss of coverage. You have 31 days from the date of the event to notify your HR team that you would like to make changes. We're going to cover your Blue Cross Blue Shield plans. So the first two plans here are the National PPO Blue Cross Blue Shield plans. The first one is a PPO 1000, 1000 being your individual deductible and 2000 being your family deductible. Now, in this plan, if you meet that deductible, you're going to go into the coinsurance, which means you pay 20% of costs until you reach that out-of-pocket maximum. Now, you do have copays available in this plan before your deductible. So if you have to go to your doctor's office, it's going to be a $25 copay, not subject to your deductible, $50 for specialist, $75 for urgent care, and $250 for emergency room. Again, these are all available before your deductible. Your pharmacy, your generic drugs, again available all before your deductible, as you have a copay up to $10. Your brand name preferred, a copay up to $35. Your brand name non-preferred, you have a copay either $60 or $120. And then you have 4 additional tiers under the specialty program. Now, preventative care services, which are your age-appropriate screenings, lab work, and immunization, are going to be covered at 100% with no out-of-pocket cost. The next plan is going to be a Blue Cross Blue Shield National High Deductible Health Plan. It is still a PPO. So in this plan, you are subject to deductible for all services with the exception of your preventative care services, age-appropriate screenings and immunization, preventative drugs, and FDA-approved contraceptives. Everything else is going to be subject to your deductible, which means you pay the full cost of all services and pharmacy. You may also open an HSA account with this plan and use those dollars to pay for your services for yourself and any qualified dependents. The next 2 plans that are available are on the Blue Cross Blue Shield Alliance plan. So Alliance, 2 different networks here. The PPO 1000 Alliance plan is a $1,000 deductible for an individual and $2,000 for the family. If you meet that deductible, then you have to pay the coinsurance until you reach your out-of-pocket maximum. Similar to the other plan, you do have copays available before your deductible. So your preventative care services, age-appropriate screenings, and lab work covered at 100%. If you have to go to your doctor's office for a sick visit, it's a $25 copay. Specialist is $50. Urgent care is $75 and your emergency room is $250. Now, again, all these services are before your deductible. That's also going to include your pharmacy. So again, you have the generic up to $10 copay. Your brand name preferred up to a $35 copay. Your brand name non-preferred is going to be $60 and $120. Then you have 4 additional tiers on the specialty medication. The next plan here is also under the Alliance plan. So this is a $2,500 individual deductible, $5,000 family deductible. If you meet that deductible, you have to go into that coinsurance, pay 30% until you reach your $6,350 or $12,700 as a family. Now, this plan also has copays available before your deductible. Your well woman, well man check, age-appropriate screenings, immunization, and lab work are covered at 100% as well. Your office visit for your doctor is going to be a $30 copay and $60 for specialist. Urgent care is $75 and emergency room is $250. And then prescriptions available before your deductible is a $10 copay for generic, $35 for preferred brand name, $60 or $120 for your brand name non-preferred, and then you have 4 additional tiers under your specialty. Now, all of the plans that we went over also offer during the pandemic, office visits or specialist visits virtually. And if you can schedule those visits virtually, it will be at 0 copay just during the pandemic. Next, we're going to go over the high HSA and the high deductible health plan. So you have a high deductible health plan being offered to you under Blue Cross Blue Shield National PPO 3500. So in order to be eligible to open an HSA account and contribute dollars into that HSA account, you have to first be covered under a high deductible health plan. And you cannot be covered under any other non-high deductible health plan, which means if you are under spouse's plan, Access, TRICARE, and you have co-pays before your deductible, you are excluded from being able to open an HSA. Also, you cannot be enrolled in any part of Medicare, and then you cannot be claimed as a dependent on somebody else's tax returns. Also, the maximum that you may add to your HSA for the 2021 plan year is $3,600 as an individual, $7,200 as a family. And then if you are 55 or over and not enrolled in Medicare, you can add an additional $1,000, making it $4,600 and $8,200. Again, this is HSA maximums for the 2021 plan year. Your HSA dollars are your dollars. They roll over year. If you leave the company, you take this with you. You own the bank account 100%. Again, you may use those HSA dollars to pay for medical services on the high deductible health plan, dental coverages, vision for yourself, spouse, and qualified dependents. Next is a flexible spending account. So again, pre-tax dollars that you elect. It is a little bit different than HSA account because this one does have a use it or lose it provision, which means you can elect up to $2,500. It is front loaded on the card, which means as soon as you get it, those dollars are ready to use. On the HSA, the money is available as it's deducted from your paycheck and deposited into an account. This card here on the screen, the flexible spending account, has a $500 carryover, which means anything in excess of $500 on December 31st of the current plan year will be lost. You may also enroll in this flexible spending account without enrolling in any other benefits. It is a standalone option. You do not need to enroll in any other benefits. Again, you may use these dollars to pay for medical, dental, vision for yourself and any qualified dependents. You also have dependent care accounts. So again, pre-tax dollars that you may select up to $5,000 a year to go into an account, and you may use those dollars to pay for services for your child care or elderly care. This is going to be your new telemedicine provider for everyone enrolled in Blue Cross Blue Shield. So you have medical services, counseling services, and psychiatry available. And during the pandemic, there is a zero copay. So once the pandemic is over, it's going to resume and you're going to pay the regular copays depending on what plan you're enrolled. If you're on the high deductible health plan, you have to pay the contract and negotiated rate with those providers. This service is a telemedicine available 24/7, 365 anywhere within the United States. So if you're traveling outside of Arizona or traveling anywhere and you get sick, this is a really good resource. So the doctors can review your illness, symptoms, and write a prescription to the pharmacy that's closest to you. Your dental plan. So you have two plans to choose from. So the first one is called the PPO Buy-Up One. So this plan you have $1,500 to use towards your dental services for yourself and any dependent enrolled in the plan. And then you get an additional $1,500 to use towards child orthodontia. Preventative care services, which are cleanings twice a year, are covered 100%. Basic services, which is going to include cavities, emergency services, endodontics, and periodontics, is covered at 80%, and you pay 20% of cost. Major services is going to be crowns, dentures, implants. You pay 50% of the cost. Now, on this plan, if you use the basic services or the major services, you are subject to a one-time deductible of $50 as an individual or $150 as a family. The next plan is your DHMO plan. So on this plan, you do have to select a provider for yourself and every family member that's enrolled in the plan. And you may each have your own provider. Now, if you do not select a provider, Delta Care will assign one to you based on your home zip code. Preventive care services covered at 100%. Basic services, major services, and orthodontia are all going to be covered under a fee schedule. There is no deductible and no annual max on this plan. You can use it as often as needed. On the screen, you will see a sample of the fee schedule. So you're going to find the dental code associated with the treatment plan that you need, and that is your out-of-pocket cost. It is not a benefit towards the service, but your complete out-of-pocket cost. This plan does cover all services with the exception of implants. You can also go to the Delta Dental website to print temporary IDs, find a provider, or find out how much of your plan or benefit you've used to date. Your vision plan, no change here. The vision plan stayed the same. You have your eye exam available every 12 months at a $10 copay. Your frames, $120 allowance, and then a 20% discount on anything above that. Your plastic lenses, single vision, bifocal, and trifocal are going to be at a $10 copay. Your contact lenses available every 12 months. You have an $80 allowance to use towards that service, and then anything over $80 is going to be a 15% discount. Medically necessary contact lenses will always be covered in full. If you are enrolled today in the Unum Life Insurance, it is changing to MetLife, so you will have to complete a new enrollment form. All employees working 20 plus hours are now eligible for life insurance. You can still purchase 5 times your annual earnings up to $500,000. The guarantee issue for those of you that are new hires or newly eligible is 5 times base annual up to $200,000. For those of you that are already enrolled today under Unum and transferring to MetLife, your max guarantee issue is $100,000. Spouse $25,000 and children $10,000, and there is no benefit reduction schedule on this plan. Your short-term and long-term disability are also moving to MetLife, so if you are enrolled today, you will have to complete a new form. So this is for off-the-job coverage due to illness or accident. The short-term disability starts to pay after the 14th day. It covers 60% of your pre-disability earnings up to $1,000 a week, and the maximum duration is up to 11 weeks. The long-term disability, same scenario. So this is start to pay after the short-term disability terminates or at the 90th day. 60% of your pre-disability earnings up to $7,500 a month. And then this plan lasts until normal Social Security retirement age. Now, if you're enrolled today in either of these policies, you have satisfied the pre-existing condition limitation. If you're enrolling for the first time, there is a pre-existing clause, which means if you saw a provider, took medication, or were diagnosed with a condition 3 months before the effective date and you went out on leave during 2021, that condition would not be paid. It would be excluded from payment for 12 months. Anything else would probably be paid. Your EAP services, your Employee Assistance Program, is available to all employees. Please access online. There is a flyer that went out to you, and then, of course, the website here. It is available 24/7, 365. You have 3 face-to-face or Skype consultations per incident. The website does offer additional resources such as will prep, discount programs, self-help videos. So it's a really good resource to use. Your AFLAC plans are changing slightly, so if you are enrolled today in AFLAC, you do have to contact Jose to make changes. Your accident plan is now a guarantee issue plan and is reducing in price, and it includes a lot more coverages. Your hospital plan is also going to be changing. Again, guarantee issue covers a lot more, so upon admission, it immediately starts to cover. Other prices have gone down drastically, so I would recommend meeting with an AFLAC representative as soon as possible. Your critical illness policy now includes your cancer policy. Before they were 2 separate policies, now they're together. Again, that's going to be at a guarantee issue and with significant savings to you. You may contact Jose via the website, telephone, or enroll online to speak to Jose or one of his members from AFLAC. Pet healthcare is still available. You do have to go to the unitedpetcare.com/CBR portal to register. The premiums did go up slightly from $10.40 to $11.60. Though pets that are covered, cats, dogs, birds, ferrets, pocket pets, reptiles, there's no pre-existing limitation or no breeds that are excluded. Legal Shield and ID Shield is still available, so if you'd like to take a look at those. So your Legal Shield is a suite of attorneys that you have at your disposal to help you with a multitude of things: contract review, will preparation, power of attorneys. And then ID theft or ID Shield helps to protect you against identity theft. They monitor the World Wide Web, your credit, to make sure that nobody assumes your identity and is trying to do assume your person and do things that they're not supposed to do. Additionally, you can enroll in one of these services or both for yourself and or your family. Next step, so everyone does need to go onto the system by the November 30th to complete their enrollment via the Darwinet system. Employees that are enrolling in the MetLife or continuing their coverage onto MetLife, you do need to complete a new form. If you're enrolling in the flexible spending account, we do need a new enrollment form. That does not carry over year. You do have to complete it. Now, if you enrolled in the high deductible health plan and you have an HSA account today, there's nothing that you need to do for that HSA account. Just indicate how much you want to go into that account. If you have any questions, please contact your HR team. And thank you so much for your time today.